Our students started COVID-19 vaccinating back in December, working with a local healthcare system. And since that time, we've worked with long-term care facilities, we've worked with health departments, and right now community pharmacies are a lot of who's vaccinating. And so we've been in a number of community pharmacies working right alongside their team. So today we are in Greene County, Tennessee, and it is designated as a rural county. And so with our mission, it's really nice to be here today. We're partnering with 3 community pharmacies to give vaccinations today. So our students are getting to work alongside those really impressive pharmacists and their teams, while also helping this important public health piece that pharmacists have come to the center of right now.
There's a lot of people that come in that are really, you know, they've not left their house in a year at this point, so they're really excited to get the vaccine, to be able to kind of get some semblance of normalcy back despite everything that's going on. So just getting that vaccine out there and kind of protecting the public's been a really good experience. So my role today, I'm more of a triage. So we've got it set up in stations. We've got a P4 student who's actually helping kind of direct patients when they first come in the door, making sure that they do have an appointment, making sure that they've got their information. They come to us, we kind of make sure that they've not had any symptoms of COVID, we check their temperature, and then we direct them to the appropriate pharmacy. Like I said, this is an event hosted by 3 separate pharmacies, and so they each have their own patient list, and we're directing them to that appropriate table so that way the pharmacy can get their information to actually bill it later and kind of keep a record of the vaccine.
This is why I went to pharmacy school. We want to help the people here. Nothing wrong with helping people elsewhere, but this is where we are. And that rural focus was really, that was me. And that's really why I wanted to go to pharmacy school to begin with.
One of the things that independent pharmacies is just so near and dear to our hearts is helping out, being a part of the community and helping to try to get as many people vaccinated as we can.
Healthcare is kind of like government. The closer it is to the people, the better it works and the more effective it is. So local community pharmacies, I think, are an important part of that. You know, we get to know our patients, we know their families, so we know a lot of times things they need that may not be obvious to somebody that doesn't know them. And you know, we go the extra mile a lot of times to take care of our patients. So, and I think the trust that we build up with our patients helps in an event like this. I mean, that may be another reason people would rather come to a local pharmacy or to this type of event where local pharmacies are, because they know the people who are there guiding the process. A lot of people have been wanting a vaccine, and I think we all, at least I believe, and most of us believe, that getting people vaccinated is an important way to get us through the pandemic, and I think that's been shown recently, and our numbers going down. I think vaccinations have played a large part of that.